Margaret is 71 years old. She lives in a small town in Wyoming. She's been on the same Medicare Advantage plan for 6 years. $0 premium, her doctors, her prescriptions. She felt safe. Then, on a Tuesday morning in late September, she opens her mailbox. There's a letter, thin envelope, official looking. She reads it at the kitchen table, and her hands start shaking. Your Medicare Advantage plan will no longer be offered in your area starting January 1st, 2026. No warning, no phone call, just a letter. Margaret calls her daughter. What do I do? Do I still have health insurance? Will my prescriptions be covered? Can I keep my heart doctor? Silence on the other end of the phone, because here's what Margaret doesn't know yet, and what millions of seniors are discovering right now. The decision she makes in the next 60 days will determine whether she has affordable health coverage for the rest of her life, or whether she gets locked out permanently. Margaret is not alone. In 2026, nearly 3 million seniors received that same letter, and most of them have no idea about the one rule, the one window, that could save them. Hi, I'm Jocelyn. I'm a Senior Policy Analyst and retirement finance expert. I spend my days reading through Medicare regulations, federal statutes, CMS guidance, and research from the Kaiser Family Foundation, so you don't have to. And I want you to take a deep breath right now, because if you got one of those letters, or if you're worried you might, I'm going to walk you through exactly what's happening, what your rights are under federal law, and most importantly, the one Medigap loophole that insurance companies do not want you to find. Now, before we get into the details, I need you to stay with me until the very end, because there is a hidden mistake, a timing error that seniors make every single year. It's not complicated, it's not about money, it's just a date on a calendar. But if you miss it, it can cost you tens of thousands of dollars in medical bills. Or worse, you could be denied coverage forever. I'll explain everything, step by step. Let me tell you about Robert. Robert is 67. He retired 2 years ago from a manufacturing job in rural Idaho. Smart guy, good with money. He chose a Medicare Advantage PPO plan when he turned 65 because it had a $0 premium dental coverage, and his primary care doctor was in network. Everything worked fine for 2 years. Then, in October 2025, Robert got his annual notice of change, the ANOC letter. He glanced at it, saw some words about plan changes. The premium was going up a little. He set it aside and figured, I'll deal with it later. What Robert didn't realize was that his plan wasn't just changing, it was leaving. His insurer was pulling out of his county entirely. The company had decided that rural Idaho wasn't profitable enough anymore. By the time Robert understood what was happening, it was February. His old plan was gone. He had been automatically defaulted into original Medicare, Part A and Part B. Okay, Robert thought, I'll just go buy a Medigap policy now. That way I'm covered for the 20% that Medicare doesn't pay. He called an insurance broker. The broker asked Robert about his health history, blood pressure medication. Okay, cholesterol, fine. Then Robert mentioned he had been treated for prostate cancer 3 years ago, successfully, in remission. Feeling great. The broker went quiet. I'm sorry, Robert. With a cancer history, most Medigap insurers in Idaho are going to decline your application. You can try, but I have to be honest, the odds are not good. Robert couldn't believe it. But isn't there a law? Doesn't the Affordable Care Act say they can't deny me for a pre-existing condition? No, it doesn't. And that's the trap. The ACA protects you if you're buying an ACA marketplace plan or if you're enrolling in Medicare Advantage. But Medigap is different. In 46 states, Medigap insurers can deny you coverage based on your health. Forever. Robert missed his 63-day guaranteed issue window, and now he's on original Medicare, with no supplement, no cap on out-of-pocket costs, and a cancer history that makes him uninsurable in the Medigap market. Don't let this happen to you. All right, let's break this down with the official facts. Everything I'm about to tell you comes directly from Medicare.gov, the Centers for Medicare and Medicaid Services, the Kaiser Family Foundation, and a landmark study published in the Journal of the American Medical Association in February 2026. How big is this crisis? According to researchers at the Johns Hopkins Bloomberg School of Public Health, and this was published in JAMA, one of the most respected medical journals in the world, approximately 2.9 million Medicare Advantage enrollees were forced to disenroll from their plans in 2026. That's 10% of all individual HMO and PPO plan members, 1 in 10. To put that in perspective, from 2018 to 2024, the forced disenrollment rate averaged just 1% per year. 1%, then it jumped to almost 7% in 2025, and now it's 10%. This is a tenfold increase in just 2 years. In 12 states, more than 1 in 5 Medicare Advantage enrollees lost their plan. In Vermont, the number is staggering, 92%. Almost every single Medicare Advantage enrollee in the state lost their coverage. Wyoming, South Dakota, Idaho, New Hampshire, Maryland, North Dakota all saw disenrollment rates above 40%. And if you live in a rural area, you are nearly twice as likely to lose your plan. What actually happens when your plan leaves? Here's what the official rules say, straight from CMS and Medicare.gov. Under 42 CFR Section 422.506, your plan sponsor, the insurance company, is required to send you a written termination notice at least 90 days before your coverage ends. That letter must include information about your Medigap guaranteed issue rights. But here's the problem. A lot of seniors miss this. The letter looks like junk mail, or it gets buried in a stack of other Medicare documents. If you do not actively choose a new plan, CMS will automatically enroll you in Original Medicare, Part A and Part B. You will not have drug coverage unless you separately enroll in a Part D prescription drug plan. You will not have a Medigap supplement unless you actively apply for one. And that brings us to the most important part of this entire video. The Medigap Guaranteed Issue Right, your federal protection under federal law, specifically 42 U.S. Code Section 1995 SSSS, confirmed in CMS publication Arrow 21110, titled Choosing a Medigap Policy. When your Medicare Advantage plan terminates or stops serving your area, you have what's called a guaranteed issue right. This is the loophole. This is your protection. Here's what guaranteed issue means in plain English. The Medigap insurance company must sell you a policy. They cannot deny you. They cannot charge you more. They cannot exclude your pre-existing conditions. They cannot make you wait 6 months for coverage to kick in. This applies even if you have cancer, even if you have diabetes, even if you have heart disease, even if you've been hospitalized. The plans you are entitled to buy under this federal right include Medigap Plan A, Plan B, Plan D, Plan G, Plan K, and Plan L. If you were eligible for Medicare before January 1st, 2020, you may also qualify for Plan C or Plan F. Plan G is the most popular choice right now. It covers everything except the Part B deductible, which is $202.90 per year in 2026. After that, it covers your Part A hospital coinsurance, your Part B 20% coinsurance, skilled nursing facility coinsurance, and even foreign travel emergency care. But here's the part that most seniors get wrong. And this is the mistake that cost Robert everything. The 63-day window. You must apply for your Medigap policy within 63 days after your Medicare Advantage coverage ends. You can also apply up to 60 days before it ends. But if you miss that window, if day 64 arrives and you haven't applied, your federal guaranteed issue right expires permanently. After that, Medigap insurers in 46 states can legally deny you based on your health history. According to the Kaiser Family Foundation, 90% of Medicare Advantage enrollees ages 65 and older, that's 22.4 million people, do not have guaranteed issue protections beyond this window or the initial 12-month Medicare Advantage trial period. And remember what I said about the Affordable Care Act? It does not apply to Medigap. KFF reviewed 15 Medigap applications from 12 major insurance companies. They found that insurers routinely deny applicants who have conditions like asthma that requires an inhaler, diabetes with complications, COPD, congestive heart failure, rheumatoid arthritis, multiple sclerosis, or any history of cancer. They also deny based on medications. If you take more than 50 units of insulin a day, for example, some insurers will reject your application outright. And here's something else you need to know. The states with extra protection. Only 4 states require Medigap insurers to sell policies to all seniors 65 and older regardless of health, at any time. Connecticut, Massachusetts, and New York have continuous guaranteed issue. You can buy a Medigap policy any month of the year, no health questions asked. Maine requires insurers to offer Plan A during a 1-month open enrollment each year. If you live in one of these 4 states, you have more flexibility. But if you live in any of the other 46 states, and most of you do, that 63-day window is everything. There's also a new development in Minnesota. Starting August 1st, 2026, Minnesota will offer a one-time guaranteed issue enrollment period during the fall Medicare open enrollment, October 15th to December 7th, for people ages 65 to 70. but the insurers can charge up to 15% more than the standard rate, and that penalty increases over time. And 9 states have what are called birthday rules: California, Idaho, Illinois, Kentucky, Louisiana, Maryland, Nevada, Oklahoma, and Oregon. These allow you to switch Medigap plans around your birthday without underwriting, but only if you already have a Medigap policy. This does not help you if you're coming from Medicare Advantage. The Part D trap. One more thing, and this is critical. If your Medicare Advantage plan included drug coverage and you default to original Medicare, you must enroll in a standalone Part D plan. If you go more than 63 days without creditable drug coverage, you will face a permanent Part D late enrollment penalty. It's 1% of the national base beneficiary premium for every month you were uncovered, and it gets added to your Part D premium every month for the rest of your life. All right, let me give you your action plan. 3 steps. Write these down or save this video. Step 1. Find out if your plan is leaving. Do not wait for a letter that might get lost in the mail. Go to Medicare.gov right now. Log into your account. Look at your plan details for 2026. If you received an annual notice of change, that ANOC letter, open it immediately. Read every page. Look for the words non-renewal, termination, or will no longer be offered. If you're not sure, call 1-800-MEDICARE. That's 1-800-633-4227. They can tell you if your plan is continuing, and if you need free personalized help, contact your state health insurance assistance program, SHIP. Go to shiphelp.org to find the number for your local office. These are trained counselors. They do not sell insurance. Their advice is free and unbiased. Step 2. Mark your 63-day window. The day your Medicare Advantage coverage ends is day 0. You have 63 calendar days from that date to apply for Medigap under guaranteed issue. Circle that date on your calendar. Set a reminder on your phone. Tell a family member. If your coverage ends December 31st, your 63-day window closes around March 4 of the following year. Do not wait until the last week. Apply early. You can apply up to 60 days before your coverage ends. Remember, you are applying for original Medicare plus a Medigap supplement. You are not signing up for another Medicare Advantage plan if you want the Medigap protection. Step 3. Gather your documents. You will need to prove your guaranteed issue right when you apply for Medigap. Keep the following: the termination notice from your Medicare Advantage plan, the postmarked envelope it came in, this proves the date, any emails or claim denials related to your coverage ending, your Medicare card, the red, white, and blue one. The Medigap insurer is required by law to accept your application without medical underwriting, but only if you can prove you qualify under the guaranteed issue right. Also, shop around. Plan G from one company has the exact same benefits as Plan G from another company. The only difference is the premium. Call multiple insurers. Compare prices. Your local SHIP office can give you a rate comparison guide for your state. And if you're switching to original Medicare, make sure you enroll in a Part D drug plan at the same time. Even if you don't take many medications now, you need it to avoid that permanent late enrollment penalty. Here's the truth. Insurance companies are not going to call you and remind you about your 63-day window. The government is not going to send someone to your door. Your doctor's office probably doesn't even know your plan is leaving. The only person who can protect your health coverage is you. And you cannot rely on YouTube notifications or hoping this video pops up in your feed next time something changes. That's why I want to invite you to join something that I built specifically for seniors who want real-time, accurate information about the rules that affect their retirement. Click the link in the description below this video. It will take you to the OW Global Senior Alerts official WhatsApp channel. When you join, you'll get instant alerts about Social Security payment changes, Medicare updates, and new banking rules that affect seniors. You'll receive a free downloadable Senior Benefits Protection Guide that walks you through all the deadlines and forms we talked about today. And most importantly, you'll know before something happens. Before a deadline passes, before a plan leaves. This channel is free. There's no catch. I built it because I was tired of seeing seniors blindsided by rules they never knew existed. If this video helped you, please share it with one person, a friend, a neighbor, your brother or sister. Someone who might be sitting at their kitchen table right now, holding a letter they don't understand, feeling scared and alone. 2.9 million seniors lost their Medicare Advantage plans this year. Don't be one of the ones who loses their chance at Medigap coverage too. I'm Jocelyn. Thank you for watching. I'll see you in the next video, and I'll see you on the WhatsApp channel. Take care of yourself.